So last week, I talked about how the Republican replacement to the Affordable Care Act is a complete and utter disaster, and I expressed hope that this bill would never see the light of day. And this is because we have reason to believe that it wouldn't be passed because there's even a number of Republicans that oppose it. Now, since I posted that video, the prospects of this bill passing diminished substantially, especially after the Congressional Budget Office released a bombshell report that actually quantified just how atrocious this healthcare bill is. So the New York Times explains the Budget Office estimated that 52 million people would be uninsured in 2026 under the House Republican bill, compared with 28 million projected under current law. The report foresees huge changes in Medicaid by 2026, it said. Federal Medicaid spending would be 25% lower under the House bill than is projected under current law, and the number of Medicaid beneficiaries would be 17% lower, with 14 million fewer people covered by Medicaid. So with this report from Trump's Congressional Budget Office, you just simply can't sell this bill to Congress, and you certainly can't sell this bill to the American people. Now, I have reason to believe that Donald Trump is jumping ship on his own bill because there was a report from Breitbart released just the other day where they tried to throw Paul Ryan under the bus. Let's listen, and I'll tell you why I suspect that Donald Trump is now trying to sabotage Paul Ryan.
There are basically two things that I want to make really clear. As for myself as your speaker, I am not going to defend Donald Trump. Not now, not in the future. As you probably heard, I just invited him from my first congressional district GOP event this weekend, a thing I do every year. And I'm not going to be campaigning with him over the next 30 days. Look, you guys know I have real concerns with our nominee. I hope you appreciate that I'm doing what I think is best for you, the members, not what's best for me. And so I want to do what's best for our members, and I think that this is the right thing to do. I'm going to focus my time on campaigning for House Republicans. To everyone on this call, this is going to be a turbulent month. Many of you on this call are facing tough re-elections. Some of you are not. But with respect to Donald Trump, I would encourage you to do what you think is best and do what you feel you need to do. Personally, you need to decide what's best for you. And you all know what's best for you where you are. But the last thing I want to do is to help Hillary Clinton get the presidency and get Congress. So the last thing we want to be doing is giving Hillary Clinton a blank check in Congress. That's why I'm going to spend the rest of this month fighting for Congress, fighting for our majorities. I'm going to spend the next 28 days working hard with all of our members to get reelected because we need a check on Hillary Clinton if Donald Trump and Mike Pence don't win the presidency. But I want to basically close with this. His comments are indefensible. They're not in keeping with our principles. So I'm not going to try to defend him. I'm going to focus on Congress.
Okay, so hear me out. I think that this attack from Breitbart on Paul Ryan, the timing is just so conspicuous because when you consider the fact that Trumpcare is currently imploding and he's chosen to not put his name on it, well, it seems as though he is trying to sow discord among the right, and he's trying to pawn this bill off on Ryan so that way he takes the fall for it. And if you get Trump supporters pissed off with Ryan, then he could say something like, well, this was Ryan's idea, and they would be more inclined to believe that Ryan is to blame for this bill. And also, given the fact that Donald Trump's chief strategist is the former president of Breitbart, this all just seems a little bit too conspicuous. I don't think it's a coincidence. I think that this is an active attempt on Donald Trump's part and on his administration to try to sink Paul Ryan and get him to take blame for this bill. Now, I may be reading way too much into this, but it really seems as though that's what's the case. And, we'll see how this plays out. But if this bill fails, then Republicans have no choice but to come up with another replacement to Obamacare, because that's what they've been saying they would do for the last 7 years. So, if they don't deliver on their one promise, they'll prove that they really don't know how to govern. But, the ultimate takeaway from all of this is that, once they inevitably come out with their shitty Band-Aid of a response to Obamacare, well, then the Republicans will be done. They'll wash their hands. They'll say, we fixed Obamacare. And obviously, there'll be more flaws with Trumpcare. And then Democrats will then try to fix Trumpcare. And then the Republicans will try to fix the Trumpcare. And you're just going to have this unending cycle of a broken healthcare system. So part of this, I think I'm seeing the silver lining in that This will all facilitate the shift towards single payer. And there's an article in The Hill that talks about how this may lead to Berniecare once and for all, because as this debate continues to unfold, support for a single-payer healthcare system continues to grow, and they explain how this current healthcare debate is paving the way for Berniecare. They state, the issue before us is how to fix Obamacare. The long overdue answer? A single-payer healthcare that I would call Berniecare. Under Berniecare, healthcare would be a right for all Americans to enjoy, not merely a profit center for giant insurance companies or big pharma. Under Berniecare, the highly popular and brilliantly successful Medicare would be the model for a Medicare-for-all system that would shift power to consumers and patients, universalize insurance coverage, and lower insurance premiums and drug costs for customers. If Trumpcare passes, there will be an electoral revolution against Republicans in 2018 and 2020 elections as voters feel the pain from the GOP plan. If Trumpcare is defeated, Republicans have nobody to blame except themselves for spending 7 years running against the increasingly popular Obamacare without having any alternative to repeal or replace it. As Trumpcare sinks, Berniecare will rise, keeping the best of Obamacare and building new bridges to true and revolutionary healthcare reform after the great debate that is only beginning and long overdue. So the answer, the fix, it's just all right in front of us. It's the big elephant in the room. There's one way you can fix Obamacare. There's one way you can end the healthcare debate once and for all. You implement a single-payer healthcare system. Now, the reason why we haven't done this is because all of the politicians, or certainly the majority, they're bought off by the private insurance industry. They accept campaign contributions from these health insurance companies that rip us off. They're then lobbied by health insurance companies. They receive talking points from health insurance companies, and then they choose to only create a healthcare plan that is within the confines of the free market. And that's not going to work. You can't economize something like healthcare. It's just not something that you want to try to make profitable. You want a system that provides health care for people. It's in the name, health care. And care and profit are mutually exclusive things. You can't try to combine those two. You can't provide adequate healthcare to people if there's a profit incentive. So you have to move towards single payer. And the silver lining at the end of this whole debate is that this is slowly but surely paving the way, and all it's going to take is the American people rising up and demanding a single-payer healthcare system. So, as Trumpcare implodes, as Trump tries to use Breitbart, the propaganda wing of the alt-right, to sow discord among the right, what we're seeing here is the extension of this stupid healthcare debate that is unnecessarily long, and more people will see that Bernie Sanders is proposing the end of this healthcare debate. Single payer, it's the way to go. Canadians are very happy. People in the United Kingdom are very happy. And it doesn't even have to be single payer, even though that'd be the easiest. If you propose some type of national health system, like the UK, like France, there's variations of systems where everyone is covered by healthcare. You will make this healthcare debate non-existent. We can move on and fix other aspects of our broken political system. But so long as we have a free market model of healthcare, and we don't even give people a public option, this debate will persist, and Berniecare will get more popular. So I love branding this as Berniecare, and we need to realize that single payer is non-negotiable at this point. I'm not willing to concede or support a politician that's not in favor of single payer. If you don't get on board with something that's an easy, common sense solution, I can't support you.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.